Hey, hello everybody, and welcome to the Functional Solutions podcast. We are so excited about today's podcast and our discussion on irritable bowel syndrome. My name is Tal. I'm the Educational Director at the American Academy of Functional Health. And with me, we have Dr. Chill, who's
Hey,
functional medicine physician with years of clinical experience in functional, integrative, and nutritional medicine. So we're here to share with us. We're here to share with you guys some of our clinical experience with more of like the root cause approach to inflammatory bowel disorders, and then looking at some of the interesting treatment protocols that you can already take from our discussion today and apply for your patients tomorrow. So this is going to be, we're going to keep it very practical, but it's really important to understand this because irritable bowel syndrome is very, very common. And there's a survey that was done by the American College of Gastroenterology, and they reported that IBS is a very common disorder, estimated to be about 10 to 15% of the people, the Americans in the United States, will have it. And there's another survey that showed that between 25 to 45 million people, million Americans struggle with IBS, and statistically about 2 out of 3 of those patients are females. So it's one of the most prevalent GI conditions, and it's one of those conditions where physicians are sometimes feel like they don't have the tools to deal with irritable bowel syndrome, because when we look at irritable bowel syndrome, that even the diagnosis of irritable bowel syndrome, right, it's through elimination of other conditions, right? So we rule out Crohn's and colitis and this and celiac, and then we say, okay, well, you have IBS, which in other words means we don't really know what's wrong with you, right? So this is a very common condition, and it's typically the major symptoms that we're seeing is bloating, abdominal pain, changes to bowel habits. This syndrome, right? This irritable bowel syndrome could be caused by inflammatory bowel diseases such as Crohn's, colitis, even celiac. It could also be caused by lactulose or fructose intolerance, so people that have those intolerances. And then there are, what we really want to take the time today is talk about what's behind it, what's causing this irritability, right? Because unfortunately, in the standard of care, going through standard of care, many patients continue to struggle. They continue to struggle. Some patients associated with, connected to their anxiety or depression or mood disorders, and some patients just don't know, right? We've seen those patients before. So today we're going to talk about what's the connection between changes to your gut microbiome. Some interesting studies there that showing that if some of the bacteria in your gut is changing, the diversity is changing, that could change the function of your gut. You can change your metabolism. You can change your immune function, right? You can change the metabolites that are in your gut. So we're definitely going to talk about that, the connection to small intestinal bacterial overgrowth. We're going to talk about the connection to the inflammatory pathways. We're going to talk about some really interesting aspects like the stress response and the HPI axis, right? And we're going to give you some very specific probiotic recommendations that you can already apply when appropriate to help your patients. So, Dr. Chill, tell us a little bit about what's the criteria for the diagnosis of irritable bowel syndrome.
Yeah, absolutely. So the thing with IBS is, outside of the statistics that you mentioned, this is actually one of the most commonly misdiagnosed conditions, just because it has such a general type of symptomatic impacts on your patients. So the common symptoms are gas, bloating, abdominal pain. This is actually in the majority of the symptoms of other conditions as well. As mentioned by Dr. Cohen, it could be IBD, it could be celiac, it could be fructose intolerance, it could be SIBO or other dysbiosis. So it's really important for the practitioner to rule out the other conditions before diagnosing your patients with IBS. So there is a specific criteria called the Rome criteria that, outside of ruling out all of the other possible conditions first, they also have to meet this specific criteria from the Rome 5 criteria for IBS. And with the symptoms of abdominal pain, they have had to have occurred for at least 1 day per week at every week for at least the past 3 months. And then the symptoms must also meet 2 special characteristics based on the criteria. So this can't just be they have gas and bloating and then they're diagnosed with IBS. So they have to have had no other diagnosis, and then they've also had to have met this Rome 4 criteria to be properly diagnosed with IBS. And then if they do have IBS, we do know from a functional medicine perspective a few different factors that are influencing or can exacerbate the IBS symptoms for your patient. So we kind of want to go into those 3 different factors for you today. One of those factors is going to be a food reactivity with IBS. What research is showing is that even though protein reactions with IBS are rare, there is some evidence that is showing that intolerances to food, especially into poorly absorbed carbohydrates such as fructose, lactose, or sorbitol, and then other fermentable sugars such as starches, this can relate or exacerbate the worsening of symptoms for your patients with IBS. Even though there's still limited data or further research needs to be conducted for these food reactions or these intolerances, we are seeing this from a clinical perspective. And then even with our patients that we see in the clinic, that these foods are exacerbating the symptoms in our IBS patients. And then there is a study that was conducted in England for food-specific immunoglobulins. And this study was conducted with 30 different subjects with the diagnosis of IBS according to the Rome 5 or 4 criteria. And this was published in the Nutrition and Metabolism Journal in 2020. What they found was that the foods high in sucrose or fructose, such as cookies, cakes, soft drinks, breads, crackers, even bananas, and some breakfast cereals, these are all fermentable carbohydrates. These have been tending to trigger symptoms related to food intolerances in the microbiome for our patients, specifically with IBS. And then a randomized blinded studies, this has also been shown in the Nutrition and Metabolism Journal in 2020. It's been shown that the low FODMAP diet was effective at reducing the IBS symptoms in these patients who were consuming the sucrose, the fructose, and the cookies. This is why the looking into the diet for these types of patients will be really important for them as well.
Yes, absolutely. The understanding that there could be metabolic issues, for example, a patient that does not process properly, for example, milk products, right? That's something that could be. We talked about food reactivity to certain foods, and we talked in our last podcast in more relation to asthma. And I shared a little bit about how when I was eating, I figured out that when I was eating dairy product, it was contributing to my allergies. It was contributing to my asthma. So that aspect is so important to recognize with your patient and understand if there's if they're eating something that causes an immune reaction, right? Have you seen any particular reactions, Dr. Chill, with foods?
In with the IBS patients?
Yes.
Yeah, absolutely. Especially the ones that I spoke about, which people wouldn't think about, right? Like fructose. They think they're eating healthy and they're like, why am I reacting to this? So these were the patients that were diagnosed with IBS and actually had true IBS, and they were reacting to fruit. And so when I put them on a low FODMAP diet, including some specific fruits that were fermenting in their microbiome, causing disturbances in their microbiome, thus causing more, triggering more symptoms of gas and bloating and abdominal pain. When I took some of those foods out for them, the severity of those symptoms started to decrease for them. So foods is actually going to be really important to look at as well for these types of patients.
Yes. Yeah, of course. And this is something that we have to consider with, because we know that statistically, as we're seeing it, it's about 1 to 2 out of 10 Americans adults have IBS. That's what the surveys are showing us. And we also know that there's a high rate, for example, when we talk about metabolic issues, right? We know, for example, that there's a lot of people out there that have lactose intolerance, which is essentially when they eat dairy products or foods that have dairy products, right? It means that they can't break down those, they lack the enzymes in their gut. The enzyme is called lactase, and they lack that enzyme that can help them to break down those products. And that happens as we age from infancy towards childhood, and then from there towards adulthood. We lose that ability to break down. We lose the amount of lactase enzyme. When you look at nature, just as a interesting side note, when you look at nature, we're the only animal, if I can call it like that, or species that continues to drink milk and eat dairy products when after infancy, right? Like you wouldn't see that happens. You wouldn't see an adult elephant goes back and starts suckling on milk, right? You wouldn't see an adult lion do that. I mean, it's something that does not happen in nature. We're the only species that can actually do that because of the processing technology and processing of food, right? So there's a lot of issues that could arise, but we have to remember that because it's quite prevalent. They estimate, the National Institute of Health estimate that about close to 70% of the world population has lactose malabsorption. So if we eat milk products in small amounts, it might not be significant, but for some people, it could be more significant. And for people who eat more dairy products, that could be even more significant, right? So it's hard to say, but sometimes for myself, eliminating dairy for 2 to 3 weeks and then bringing dairy back, I kind of felt it. Like I kind of already knew. I didn't need to spend money on lab testing. My body was telling me, like, my symptoms would come back, right? So it's important to know. And if your patients are struggling, maybe one of the things that you can do is look at removal of dairy products for 2 weeks and see if that makes things better. Removing of wheat, that's another thing that we're seeing. And so those are major things. So I'm so glad that you you talked about this, Dr. Chill, because this is so important, right? And you mentioned the low FODMAP diet, right? I know that you've used that on multiple patients. And what was your experience with using the FODMAP diet? Like, how do patients typically respond?
So this isn't meant to be a long-term approach because
Mhm.
the FODMAPs diet is a pretty strict diet. So I had to ease my patients into this, right? Because this is a lot of foods that you have to eliminate. So we would start with the main things, the main culprits, such as you were mentioning, lactose is a main culprit of that. And I was actually reading new research as we don't produce the lactase enzyme after the age of 2. So the majority of us, and I think Dr. Cohen was mentioning, I think about 70% of us don't have that enzyme or we're deficient in it. So we can't actually absorb lactose properly. And this is evident with these types of patients or with IBS patients as well. And lactose is going to be a main player in this. So we would start with removing dairy first. They would start to get better, and then we would go into some of the harder foods, right? Some like the fructose, the oligosaccharides that are within the FODMAPs diet. And then I would have them stay on the FODMAPs diet for a few weeks. And then we will look at slowly reintroducing foods back while we were healing their digestive issue or their digestive issues. If they had in some sort of dysbiosis, which we'll kind of get into as a main contributing factor to IBS as well. And once you start to kind of get rid of that and start to heal the gut, then they're able to incorporate more foods back in moderation. And now this isn't going to be an everyday thing, but if they're able to incorporate some of the fruit back, some of the oligosaccharide types of foods back into their diet without any issues. But this isn't meant to be a long-term thing. And what I saw with patients was that when we started to eliminate some of the main culprits, they came back in a couple of weeks. And one of the biggest things was they didn't realize how bad they felt. They were getting to a new norm. They're like, I didn't realize I was feeling that bad because now I am feeling this good. And then the second that they incorporate food that would cause more inflammatory processes, they would feel those impacts immediately. Where before, because they were incorporating so many different foods, it was just kind of like everything was impacting them. So they started to really know what was impacting their bodies and their systems through the foods that they were eating by eliminating some of the things like the FODMAPs diet.
Yes, absolutely. I think that's, like you mentioned, ideally in an optimal situation, we will use the low FODMAP diet. And we have to consider that, like you mentioned, it's you got to ease them into it. And we also have to consider that while that might be an ideal situation, some patients might have a resistance to do so. I used to have a colleague from Florida who used to always tell me it's easier to change someone's religion than to change their diet, right?
It can be very difficult. But if you've been dealing with pain for so long, you're like, let me do anything.
Exactly. So depending on the level of readiness when they come to see you, sometimes a good approach is to have them maybe just reduce dairy products for 2 weeks and see. Give them address their gut health and give them a certain probiotic that we're going to talk about in a few minutes, get some improvement, and then they come back and they're much more open, because once they start feeling better based on when they work with you, now they understand that working with you is something that is going to be very beneficial for them. So sometimes they come back and they're like we all had those patients that you talk to them about, you start having the conversation about healthier foods, and they say, like we had a diabetic patient that once told me, I'm willing to do everything I'm willing to do everything because they're developing neuropathy, they couldn't sleep at night, it was ongoing pain and all of that other stuff, and they're starting to understand the situation, the bitter situation they're in. But they said, I'm willing to do whatever you ask me to do, but don't ask me to give up my potatoes. Like, I love my potatoes. I'm not going to give that up. And I said, okay, that's perfectly fine. Are you open to replacing sugar with something else, with stevia? They said, yeah, I'll do that. Are you open to reducing gluten? Oh yeah, I'm having to do that. Are you open to taking a supplement or two? We can work on, on this and that. And throughout the 2 to 3 months that we were doing that, of course, we got their functional labs back, so we had a lot more data to work with. And then they also saw, when patients see the data and you explain to them, it really opens up their eyes to what you're doing is very scientific. It's very, very evidence-based. And as that patient was getting better, 3 months later, guess what we took off? Potatoes. Right? So now, that patient 3 months later had probably about 60-70% reduction in their of pain in their feet. So they could sleep better at night, they can walk better, they felt better, they had more energy than ever before. So now they're more open to making those adjustments. So you got to meet your patients where you are. The easiest way to do is just maybe focus on 1 or 2 things, and supplements are easier because patients, to them, it's like just taking another pill. It's fairly simple for most patients to do. Maybe that's a good place to start for some patients.
Absolutely. It's all about moving that needle for them little by little. And then the more you move that needle to health improvements, the more they're seeing the benefits of it, the more that they're willing to do. And then also the labs is going to be, it's really helpful because it helps us provide the reasons why. The patients always want to know, why is this happening and how can I address this? And then the lab results is going to kind of give you the scientific evidence behind what is happening to their body systems or the dysfunction of it.
Yes, absolutely. So, for example, in this term, when we talk about food allergies or sensitivity, if you send out to a lab a sample of their serum and test for IgE, IgA, IgG, or ALKA test, which tests for white blood cells reactivity to foods, and you get that report, right? There's really not much doubt or an argument there, because it's them seeing the results of what the lab is sending. So it's not just you saying, don't eat gluten, don't eat sugar. It's like they can see it in the labs. They can see that it's flagged in red and there's a reaction, right? So now they're starting to make that connection. What we also want you to be aware, the reason we talked about lactose intolerance is because lactose intolerance is non-immunological, right? So we're not looking at an immune reaction. We're looking at a problem with metabolism, right? Which is, as we grow older, after infancy, we lose the ability with the number of that enzyme that lactase that breaks down the dairy product is deficient. So we just can't break it down. The only solution for that is you significantly reduce or eliminate dairy products. And once you feel better and you're in a better place, you can use enzymes. You can supplement your patients with enzymes, which is something that we would typically recommend patients with IBS to take enzymes, the good digestion of enzymes that can help them to break down the food better, right? While, like Dr. Chill said, while we work on the root cause, right? So that's all important things. And that really takes us to another major factor. We talked a little bit about the association, the connection between anxiety and stress and IBS. And there's multiple reports that make that connection between patients that are stressed, have anxiety, and they also have IBS. And we understand that because when we are stressed, right, or frightened, we have this sympathetic system that kicks in, And it essentially what it does, it reduces blood flow, right? It's our fight or flight reaction, right? It reduces blood flow to the gut, improve blood flow to the muscles, because you're ready to either fight or flight, right? Or run away. And to our body, this old evolutionary system unfortunately doesn't distinguish between a lion chasing us, which is a real distress, right? And it's a real life-threatening situation, and between us getting stuck in traffic or have a massive project or our kids are screaming at home. Like, either way, it's going to be stressful, and our body will go into the sympathetic, will activate the sympathetic system. So we know that overactivating that sympathetic system, that stress response, that we call it the HPI axis, right? That hypothalamic, pituitary, adrenal organs in that axis. If we overstimulate that, we have continuously have stress. We don't manage it by walking, exercising, breathing, whatever it is that we need to do, reading a good book, something to relax that stress or manage it, right? That overactivation could lead to a decline in function and reduction in the secretion of the stress hormone, cortisol. So this is where we want to understand the connection between the HPI axis and IBS, because that will allow you to address another root cause that your patient might be struggling with. So Dr. Chill, can you share with us about the HPI axis and what's the connection there? How do we see it? How do we, how do we treat that when we identify it?
Absolutely. So this is another thing that we want to kind of show our patients is some of the evidence behind why we're doing some of the things, right? So you were mentioning stress can be a contributing factor to IBS and the worsening symptoms of IBS. So in a few different studies, one in particular was showing that stress hormones, and in particular excessive stress hormones, as Dr. Cohen was mentioning, it's these excessive levels of the stress hormones that is activating the HPA axis and causing it to go into imbalance. So it's that imbalance and it's that excessive stress hormone that has been shown to induce the colonic motility in IBS patients. And this was done versus a control group. So this was a study that was published in the Gut Journal in 1998. And it was a study conducted with 10 IBS patients versus a control of 10 healthy people. It showed that excessive stress hormones, in particular, being released from the CRH, this produced a duodenal phase 3 motor activity in 80% of the subjects, and then duodenal dysmotility in 40% of IBS patients. So this is showing that IBS patients with excessive cortisol levels, they were having longer symptoms of IBS than any patients that were in the control. So there is a brain gut association in IBS patients, and it's showing that they are having exaggerated symptoms due to cortisol issues. So if your patients do have excessive stress, so you can assess this through their intake. You can assess this through lab testing. And if you are assessing that they have excess cortisol or excess stress, then there are a couple of things that you can do. You can talk to them about stress reduction techniques, but we also want to give you other options that they can do. As we were mentioning, we want to meet the patients halfway. So what are they capable of doing? Can they do stress reduction techniques all the time? Or do they want to incorporate some other things such as supplementation into this? So we want to give you some of those options as well. One awesome supplement is ashwagandha. This is an Ayurvedic herb, and this has been used for fatigue, for balancing out cortisol levels, for balancing out the HPA axis. And it's also been shown to help with balancing out the adrenal system. It contains several active ingredients, including withanolides, saponins, withaferins. And what you want to provide or recommend for the patients with ashwagandha supplementation is 250 milligrams per day and or up to 600 milligrams per day for at about 60 days, because this is an adaptogen. So you actually need some time for this adaptogenic herb to take effect. So 60 days is going to show some significant reduction in stress levels for patients with IBS.
Yes, and I'm so glad that you brought that up, because this is something that understanding that's HPA axis and that's connection between stress and how it would impact the gut is so important. There's, as Dr. Chill mentioned, ashwagandha is a powerful adaptogenic that was found to be really helpful with regulating that. And if you're interested in learning more about this connection between the brain and the gut, we have a wonderful class by Dr. Caviola, who is in the functional medicine, the advanced program, and he dives into the gut-brain axis, showing you how it works. It's bidirectional connection. It's not just stress impacting the hypothalamus and different areas in the brain and causing this cascade of release of activation of the fight or flight reaction and cortisol or adrenaline and all of those. It's also bidirectional, which means that changes in our gut, there are some interesting studies showing association between changes in our gut and more predisposition for anxiety, mood disorders, all the way to neurodegenerative conditions. So when a patient has dysbiosis of their gut bacteria, change and negative or harmful changes in their ecosystem in their gut, that leads to inflammatory markers. That leads to a systemic, subclinical systemic inflammation that could also lead to some of those bacteria leaking through the gut barrier into the bloodstream, and some of those metabolites that are secreted can actually cross through the blood-brain barrier. So, of course, we're not going to dive into that because that's a big topic, and we have a whole class just on the gut-brain axis, which would be really important for you to know if you're seeing patients with mood disorders, if you're seeing patients with neurodegenerative conditions. Really, really important for you to know, especially when we talk about digestion disorders, right? And so, but just remember for now that when you address the gut, when you heal the gut, when you optimize the gut function and the gut microbiome, you essentially improve and optimize the function of that connection between that gut-brain axis. And so this is, of course, when we we go in and talk about those different topics, and dysbiosis is one of those major topics, right, Dr. Chill?
Absolutely. And it's a major contributing factor in a lot of conditions, and IBS is no different. And what we want to discuss is why are we bringing up these contributing factors, right? Because it's these contributing factors that are exacerbating the symptoms of our IBS patients. So we want to address assess all of those contributing factors, and then look at some ways from a functional medicine perspective to address them for our patients to reduce all of the symptoms that they are having. And dysbiosis is a major contributing factor in IBS. And there's multiple studies that is showing this. And what the studies are showing, this was actually published in the Journal of Gastroenterology in 2005, that there were multiple studies showing that patients with IBS had a significantly different microbiome profile than people with without IBS. This is meaning that patients with IBS had some sort of imbalance in their microbiome, which means dysbiosis, right? So their microbiome isn't in balance, and it isn't doing what it's supposed to be doing, which is going to impact a majority of the rest of the body systems. And in particular with IBS, it's going to impact the gut health, and then how they are presenting with symptoms. And so what we can also look at, another study that was published in the Journal of Gastroenterology with dysbiosis, was conducted on 87 different subjects, and they were enrolled in a double-blind, randomized, placebo-controlled study. And this study showed that people with IBS-C or D, so IBS stands for IBS with constipation, IBS-D stands for IBS with diarrhea as the primary type of symptoms. And the patients in this study showed that they either had a severity or an increase of constipation or diarrhea due to a specific type of dysbiosis called SIBO, which is small intestinal bacterial overgrowth. And this was either from a overproduction of methane production or hydrogen dominant in SIBO, which determined what type of IBS that they had. So there was a specific type of IBS that was being induced through a dysbiosis or an imbalance of the microbiome. This is enlightening for us, because we can use that information to hone in on the specific treatments for these patients. So if you showed and you tested that your patients and they tested for SIBO, we can address that from a functional medicine perspective to reduce their IBS-C or IBS-D symptoms for them. And we'll actually discuss a specific type of supplementation that can actually help with reestablishing the microbiome.
Yes, absolutely. There's a few really interesting probiotics that essentially what we're doing is we're providing the body with some additional beneficial bacteria that can help us to properly break down the food that we're eating, especially carbs. And we know that when a patient comes to see you and complain that they have abdominal distension and pain, right, or gas, we know that there's either one, they got higher amounts of the harmful bacteria, right, or imbalanced bacteria. That's what we call dysbiosis or SIBO, small intestinal bacterial overgrowth, right? Possibly, that's something we can test. But on the other hand, it's very likely that they also have a lower amount of the beneficial bacteria, right? Because when you think about it, when a patient has bloating and gas, it will typically be some sort of bacterial imbalance, because there are no mechanism in our body that can produce gas in that way in our digestion system. It will mostly happen because of fermentation of fiber or carbs in our digestion tract by the by the gut microbiota. So by introducing the proper probiotic, the beneficial bacteria, we can help the body to better metabolize those. So there's multiple studies that have shown those beneficial. These studies were published in Journal of Gastroenterology and Hepatology in 2010. As one study, as a double-blind placebo-controlled trial, looked at VSL number 3, which is one of the most studied probiotics, VSL number 3, in the treatment of IBS symptoms. And it's VSL number 3 is essentially a combination of multiple strains that were found, research-based strains that were found to be beneficial. And those are, it contains live bacteria such as Bifidobacterium, Lactobacillus, Streptococcus salivarius, and other beneficial strains. And this particular study had 48 IBS patients with abdominal bloating. And they compared VSL3 to placebo, and they found that there was a significant reduction in the probiotic group in flatulence and a delay in colonic transit. So essentially, it helped significantly improve the symptoms of IBS. It can help improve when patients have diarrhea, when patients have bloating, when a patient have abdominal discomfort. There's a meta-analysis that looked at 9 clinical trials with 772 patients that showed significant improvement. And this was published in the Journal of Gastroenterology and Hepatology in 2010. So there are different probiotics, obviously, that you can use, but VSL number 3 is, I would say, probably among the most beneficial. I'll add something to that. I mentioned previously about digestion enzymes. So there are interesting reports about digestion enzymes used with inflammatory bowel disease and irritable bowel syndrome. So some of those were supplements of inositol, beta-glucan, and then digestion enzymes. What I would typically recommend any patient that comes in with bloating, we want to address the foods that they're eating. Obviously, we don't want them to keep eating foods that can trigger that. For some patients, it would be dairy products. We talked about that. We talked about wheat for some patients. Sugar might flare up this condition because sugar contributes to the overgrowth of harmful bacteria, right? So you can lead to dysbiosis if you consistently eat sugar, and sugar is in soda drinks, sugar is in processed food, right? Fast food, sugar is in so many of our foods, and even in stuff that shouldn't be, like salad dressing. Most salad dressing out there has sugar, right? So we just got to be more conscious, more aware of that. But digestion enzymes, there are multiple companies that you can look at, and there's Pure Encapsulation. So they got a good product. Dr. Chill, maybe you have some recommendations as well.
Yeah, Claire Labs is great with probiotics and digestive enzymes. Soroil or Genestra, they have some great digestive enzymes as well. Orthomolecular is another great brand and company to look into. And you can find those all at Fullscript or Emerson. All of those companies are there.
Yes, absolutely. Those are all really, really important. So typically digestion enzymes, you look at full spectrum, or it'll just say digestion enzymes. If your patient have problems with breaking down with gas or discomfort after they eat fatty food, then that could be that it's not just a deficiency of the pancreatic enzymes. It could also be that their liver and gallbladder do not produce or do not secrete enough bile, right? So it could be an obstruction. It could be something that is causing lack of bile. So if that happens, you can find a product that has ox bile extract. So you can actually find supplements that have ox bile extract, and that you take that with meals that contain fat, and then it helps you to break down that meal. So there was one product. Dr. Chill mentioned some really good professional grade companies. There's a specific product that is called Digestive Enzymes SAP, and that's by Nutritional Fundamentals for Health. It's called NFH, Nutritional Fundamentals for Health, and that's another professional grade company. And that particular product has pepsin and pancreatic enzymes, and it also has some betaine hydrochloride, which increases the pH, decreases the pH in the stomach, so increases the acidity, so it can help you break down the food much better. And then it also includes ox bile extract. I've actually tried this product before, and it was pretty good. It was a pretty good product to try if you're eating and you get bloated for whatever reason, right? For some people, that could be the mixture of. I even had patients that the combination of different foods would sometimes trigger that, right? So using a product like digestion enzymes could be beneficial while you work on conditioning the gut and improving health and all that other stuff. So I think those are all great to mention. And then, of course, there's something to be said about mindfulness eating, which is making sure to remind your patients that before they sit down and eat, to just maybe take a deep breath or two, maybe relax a little bit. In some cultures, there's a practice custom to say grace, and say gratitude for the food in front of you. So I found all of those practices, whatever you adopt and you ask your patient what they will feel most comfortable adopting, it's very helpful. So when I used to work with more religious individuals, I would just ask them to take a minute before each time they eat a large meal and just to say their gratitude for something in their life and for the food in front of them and for good health. And just doing that, just that act of pausing from the busy world we all live in and saying thank you for something that you have in your life or the food that you have in front of you. It helps to kind of shift things from a sympathetic to a parasympathetic, right? So anything that you can do to help them, maybe even reminding themselves to properly chew, right? If we eat in front of the TV or if we eat while we're rushing from one place to another, I completely admit that I've done that so many times. But it's just not the right way to process and metabolize and allow our body the calmness that it needs to break down the food, right? Is there anything that you
I love that practice. I'm a foodie, so I love food, and I need to constantly remind myself that. And so, like, my patients are the same way. They're a lot of food lovers, and so just that act of taking a deep breath before you eat allows you to appreciate the food, allows you to really taste and enjoy the food instead of just shoveling it in and then you're done. So just that simple act is not only just going to help you enjoy it more, but it's actually going to help you metabolize it better and it's going to be better for your digestive system.
Absolutely. So if you guys take something or 2 or 3 things from today for your patients to help your patients in your community when they're coming to see you with IBS, you might, with just the principles you learned today about gut health, about probiotics, about food reactivity, about the HPA axis, the stress response, right? Just with these principles, you already probably know how to help them much, much more than most primary care out there, right? Which will do not much more than refer them to a nutritionist or try to rule out other conditions. And we all know that that's really important to make sure that they don't have celiac or colitis or something else going on there. But once those are ruled out, that you are going to be the person that provides them with the most effective solutions for their problems. So we hope that you enjoyed this. Keep learning about the root cause, keep building up your skills, and we really appreciate you showing up for your patients every day. And we know that patients bring challenges, and we that's what we're here to give you more tools to continue to advance your clinical skills, so you get better clinical outcomes. So you really change the lives of people in your community. So I want to thank Dr. Chill for being here, for sharing his experience as well. And if you're interested in more information about the root cause approach, you're welcome to join our community at the Advanced and Clinical Functional Medicine program, where we talk a lot about gut health and environmental and nutrition and herbal medicine and evidence-based treatment protocols. So we'd love to have you. In the meantime, take care, and we'll see you in the next podcast.
See you guys next week. Bye.